Cancer is really just when a cell decides to divide abnormally. This can happen to animals, plants, humans, everybody is affected by cancer. What we don't know always is why this happened or when it's going to happen. And that makes it quite difficult to then predict who's going to be affected by it.
We need to know about different people and how cancer affects them, because in the design of services, especially treatments, for example, and post-treatment care, we need to address what people need so they continue living the better lives after having the surgery, for example.
I'm Brian Nicholson, I'm a GP in the NHS, so spend a lot of my time talking to people about their symptoms and working out which people should be referred for further investigations. Primary care is the first place that a patient goes to seek care, and we'd love you to take part in our research.
The reason why patients get to the hospital is through their GP. They're the first port of call when patients are concerned about symptoms or what's going on. So without interacting with the GP, we wouldn't see patients. And with GPs having access to blood tests easily, that means that they have the power to diagnose cancer earlier, making sure that people get referred to the right test at the right time.
We're trying to do research that will not only benefit people, but will benefit all types of people. So we're trying to engage with various underserved groups, people who don't normally go and see their GPs about symptoms, trying to encourage them to get involved and generally do research that would benefit them as well.
I think it's important that everyone gets involved in research when they can. Because when we're developing, for example, a blood test that looks for cancer, we want that blood test to work for everybody, not just one section of society. That means that we want people from all backgrounds and all walks of life to get involved in the research.
We know from talking to patients that there's concerns about the confidentiality of their data, but within the research environment there's very, very strict regulations about what we can and can't do with patient data.
So I, as a researcher, for example, as a data analyst, I never receive information about the patient that would let me identify who they are. So I never receive their name or their NHS number or anything like that. And the data is always confidential as well, so it can never be shared with anyone who doesn't have approvals for it.
There's a bit of fear. There's the fear of, if I get involved in this trial, will my doctor stop seeing me? Will my GP not treat me, for example? There are other barriers, like how often do I need to come into the clinic? Who will I be speaking to?
There's lots of different ways that you can help with research. It could just be simply an afternoon. It could be a Teams meeting in a focus group.
Just by taking part, I think, in primary care level research, via your GPs, which you're familiar with anyway, you are actually contributing to making things better for everybody.
Not only are you helping us, you're helping yourselves, your friends, your family, and everyone else around you.
So if you'd like to take part in research, please ask your GP surgery if they're taking part in any research, and please check the links at the end of this film.
Every bit of involvement will make a difference to people like you and people in your community. So my words would be to get involved and trust the research process.